Hello, I'm Marj Droppa, Project Director for Impact Monadnock, a non-profit organization in the Monadnock region that believes by investing in early childhood, we can help our whole community thrive. How? By starting small and thinking big. Starting with our youngest citizens, aged birth to 5, thinking big impact for the entire region, children and adults alike, because by investing in children when they're small and when their brain development is key, you can have the biggest impact not only on their lives, but on the well-being and economic success of our whole community. Our success depends on our youngest children developing into the 21st century leaders and employees we need them to be. This webinar explains the evidence behind the development of a strategic plan that aims to improve the lives of children aged birth to 5 and their families. In 2015, Impact Monadnock did a gap analysis to identify the challenges that our children and families are facing in the Monadnock region. Of the 55,000 people in families in Cheshire County, about 4,200 are children aged birth to 5. That's about 8% of our population. Our research shows that the birth rate is declining here, with fewer than 500 children being born in Cheshire County each year. The gap analysis found 3 greatest areas of need for this age group and their families: early childhood supports and services, behavioral health supports, and parent and family support. In our first focus area, early childhood supports and services, we found challenges around regular screening of all our children for developmental delays and access by our families to quality childcare environments. The data shows that about 60% of our young children aren't being regularly screened for developmental delays. This is a problem because it means we can't provide early intervention supports and services for these children if we don't know about them. This can affect their future success, not just in school, but in life. About 42% of our children birth to 5 aren't in a licensed childcare program. Now, this doesn't mean that children aren't in a quality homeschooling environment, for example. But what it does mean is that we just don't know where or how a significant number of our children are being educated. Also, licensing is an indicator of quality and helps us assess the type of childcare being received. For every 2.35 children in the Monadnock region, we have 1 childcare slot that's licensed or accredited, compared to 1 childcare slot for every 1.75 children in New Hampshire. Our second focus area in the gap analysis was about parent and family supports. We looked at the impact of toxic stress on a child's brain, such as child abuse and family addiction, and how evidence-based programs like home visiting can alleviate chronic toxic stress. Our research showed that the child abuse and neglect, which is related to toxic stress, is higher in Cheshire County than all but 3 other counties in New Hampshire. Also related to toxic stress is educational attainment, teen birth rate, and substance misuse, which you can see from this slide we are not doing well in compared to the rest of the state. We know that home visiting programs, where a trained professional visits with families in the home, can help alleviate toxic stress and its sources. However, as you can see from this data, only a small number of our families get home visiting, and of those, 1 to 2 visits was the norm, when ideally you would receive several visits over a period of time. Our final focus area was behavioral health. This was an assessment of the social and emotional well-being of our very young children and their families. Our key findings were that there is very little mental health support for this population in our region, and few were prevention-based. Moreover, of the 400 children aged birth to 5 diagnosed with a serious emotional challenge in 2015, only 1/3 of those were able to get the help they needed. So what can you do to help? Please visit our website for ideas and listen to our second webinar on our strategic plan and how we're addressing those gaps and challenges identified in the gap analysis. Thank you for listening and for helping our children and their families to thrive in the Monadnock region.